Well, our breast cancer awareness coverage continues today. I spoke with the nurse practitioner at IU Health Arnett about the high-risk breast cancer prevention program. She explains what the program is and the impact it continues to have.
We've had a really positive response from the patients so far. They seem to be really enjoying it.
Nurse practitioner Delaney Baer says the high-risk breast cancer prevention program at IU Health Arnett started in 2021 and has continued to see great success.
The patients that I get to see, I've been really enjoying getting to see them every 6 months and establishing that relationship with them.
The patients are first screened through IU's mammography department, where they'll be asked a variety of questions, including family history. Once the screening is done,
And then they calculate a risk score.
your score will determine if you're eligible for the high-risk breast cancer prevention program.
If you have a score of 8% developing breast cancer in the next 10 years, you then qualify for the high-risk breast cancer prevention program.
Baer says another type of testing is available based on a patient's family history.
So if somebody says they have multiple family members with either breast, ovarian, pancreatic cancers, we do then offer genetic testing.
For patient Amy Mellon, genetic testing is exactly what she had to have done. She was already considered a high-risk patient prior to the genetic testing. Part of the reason for that is because of her family history.
My sister was diagnosed, like I said, she was at a very young age.
At the age of 33, Mellon's sister was diagnosed with breast cancer.
She went through chemo and she went through radiation. She had her mastectomy.
The cancer eventually spread and her sister lost her battle with breast cancer.
I had been getting mammograms at that point, and I'd had a biopsy at that point, but this had really pushed it that it's, even more necessary now.
Mellon has continued to work with doctors to keep a close eye on her health.
My risk factors, I have a 30% chance of being diagnosed with breast cancer in the next 10 years.
Through the program, she comes in every 6 months to have a mammogram. Mellon says she's thankful for the support and care she's received.
I can come in and I've cried. I have cried a lot, and they've walked me through it, and they helped me out so that they've taken my panic down.
Baer understands being identified as a high-risk patient can be nerve-wracking, but she encourages all the patients not to be nervous.
There are early detection measures we can do. There are, more enhanced screenings that we can do. Technology is advanced. Research has become more advanced.
Well, Baer says the high-risk breast cancer prevention program gives patients an opportunity to become more aware of their specific situation.